Hi everyone, my name is Christine. I work at the intersection of art and science. My training is in biomedical communications at the University of Toronto, and now I'm an information designer and I work in healthcare. So I'm excited to be here today to share with you some of the things I've learned designing for decisions in healthcare. I'll start by giving an introduction to what I do and then share some of the things I've learned. So by way of background, I'm from Canada, and in Canada, healthcare is delivered through the system of provinces and territories. I live in the city of Toronto, which is in the province of Ontario. And so for me, it's the government of Ontario that manages the delivery of care. And this isn't an easy job because healthcare is very complex. We have many moving pieces that need to work together. We have hospitals and home care and clinics, medication, labs, and these all need to be well coordinated in order to give effective care. And so the role of the agency I work at is to advise the government and other key decision makers on aspects of the healthcare system, things like cancer, renal care, access to care, and more. So one of the things my agency does is gather data on the healthcare system, we'll analyze it, and then communicate our findings with the goal of enabling positive impact. And as an information designer, my role is really focused on this question of communication. How do we best share our data and analytics? And so there are some challenges when it comes to communication and doing this well. At its core, my goal is to enable effective decision-making, and so that's going to be a key consideration. But before I can get to the decision-making, I need to think about how is information going to be delivered, so how will I transmit this information? And then the layer people see when it comes to data analytics is the visual design. So how will information be displayed? So I'll talk about these three things from the outside in, starting with design. And here I'm really thinking about the visual design. How is information displayed? So whenever we have information, there's a range of options for how we might display it, spanning from the very representative all the way to the very abstract. Now in healthcare, we spend most of our time on the abstract end of this spectrum. And that's because our audience tends to need very high precision to do their work. So we do a lot of charts and graphs and tables. But even within this narrower range, there's still a challenge of determining what is the best option. I'll give you an example. So here I have a data table looking at patient flow. So I have patients living in different regions of the province, and I'm looking at what hospitals they might go to get care. Now I can show this information in a table, and that allows my audience to get high precision and see exact numbers of patients they need to plan for. But it doesn't give a good sense of high-level trends and patterns. So an alternative approach might be to use something like a Sankey diagram. This is a visualization where I have on one side of it the regions, and the width of the line moving across shows the number of patients moving to different hospitals and which hospitals they're going to. So I might show a more visual representation like this so that my audience can get a sense of patterns and relationships, see high-level trends, and once they understand that, they can refer back to the data table to see more detailed information. Now, even once you decide the visual approach, there's still a question of formatting and visual design. So here's another example where I have a data table of patient characteristics who received a particular type of training. I can still improve the visual design of this by using things like color, line, grouping, all those basic graphic design principles to improve my data table. And for some of you, this may seem like a very simple or obvious change to make, but it really does have a big impact. This makes the final product not just more aesthetically appealing, but also better directs attention to those areas that matter. So that's visual design. The second challenge I want to look at is delivery. And there are a few different ways you can think about the question of delivery. On one hand, you can think about delivery channel. So are you going to convey information through email, through an online portal, through a print copy? There's also the question of delivery format. So are you making a static document, an interactive report, a web page, or something else? And thirdly, you can think about the question of delivery interface. So once you know what visual content you're going to convey, how will you package it so that your audience can easily navigate to the information they need? For today, I'm just going to look at delivery interface. So this matters because at my agency, we send out a lot of reports to a lot of different people. And there's the risk of kind of overwhelming our audiences with information. So you can imagine if you were the CEO of a hospital, you're receiving reports on many different diseases and maybe looking at your current performance or your future projections. One challenge might be that you could be receiving these documents from different teams, and each one might be using a different design and interface to organize its information. So when you open in a report, you have to figure out every time, what's the content in this document, where do you find it, and what are the key insights. You might be getting essentially unique Excel files with information hidden in different tabs. And so one project I've been working on is developing some standard guidance around information organization and navigation design so that we don't demand our end users do a lot of relearning of interfaces. I'll show you a few examples. This first one is a scorecard looking at renal care and how different renal programs are performing across the province. And you can see at the top there's a standard kind of navigation bar to structure and organize the information. This second one is a systemic treatment resource model for cancer. And again, different visual content within the document, but the organization at the top is somewhat standardized. This third one is a current state report looking at the demographics of cancer survivors. And so for each of these, you can see very different visual displays, yet use a very similar design for their delivery to help audiences more easily find and focus on the information. So my third challenge is that of decisions. When sharing healthcare information, there is the purpose and goal of enabling better decision-making. And so when conveying data, it helps to not just visualize it, but also to give guidance into how to read it. And this can be done both implicitly and explicitly. As one example of implicit messaging, let's say I have information on wait times and how it's trending. Depending on what aspect ratio I choose to use, I can make that trend line look like a very gradual rise or a very dramatic rise. And so you can see how something like the choice of aspect ratio can really impact the interpretation of data. As an example of explicit messaging, this comes up more often when I have something like a target or a limitation in resource that I want to alert my audience of. And so in this first graph, I'm looking at the occupancy of a particular hospital. I can add some explicit messaging by doing things like highlighting key areas of the graph or saying so in text so that my audience knows, oh, your occupancy is nearing its capacity. This means you need to take action. So we have these three challenges: design, delivery, and decisions, and all of them have to be considered when it comes to information design. However, we can think of these not just as challenges, but also as opportunities. We talked first about visual design. We can use visual approaches that work for our audiences and also how to visually style for clarity. We can design the delivery of our interfaces to help audiences more easily and efficiently locate information. And we can think about how to enable decisions, so giving guidance into interpretation through implicit and explicit messaging. And this is how information design impacts the healthcare system, by sharing data and analytics to enable decision-makings around resources, services, delivery. It improves both the business and operations side as well as frontline clinical care. And there's still a lot of work to be done in analyzing, understanding, and communicating this information effectively. But it really is an impact to use information design to improve the healthcare system. So thank you all for listening. I also want to say thank you to the many colleagues I've worked with on the examples shown today: Catherine Chan, Jonathan Wang, Audrey Wong, and many others. Happy to chat with you all more during the breaks today as well. Feel free to visit my website to see other work I've done. Thanks.